Compression parameters and proper indications. Compression therapy consists in applying some material around the leg to exert a compression pressure able to oppose to edema formation and/or counteract the ambulatory venous hypertension. It can be exerted mainly by elastic stocking, elastic bandages or inelastic bandages, adjustable compression wraps, or pumps. But basically, all these compression material can be divided in two main categories, elastic or inelastic. And these two kinds of compression have completely different physical properties. Inelastic material, starting from a comfortable pressure, may exert a very strong pressure during movement or in standing position. As you see here, starting from a pressure of 40 millimeters of mercury, just doing a dorsiflexion in supine position, you can have more than 100 millimeters of mercury of pressure. The same happens when you stand up. The difference in pressure is extremely high, and when walking also is extremely high. This is not the same with elastic material. With the elastic material, you have a much lower pressure in supine position, and the differences with movement, dorsiflexion, standing up, or walking are very low. Now we need to know that only a strong compression is able to occlude the veins. So we need to know which is the intravenous pressure in our legs in order to know what kind of pressure we need to apply to exert an hemodynamic effect. And already by physical law, we know that our intravenous pressure in the leg is around 60 to 90 millimeters of mercury, depending on the measuring site. And so if we want to overcome this intravenous pressure, we need to apply a compression which is higher than intravenous pressure. And this is possible only with inelastic material. If you look at inelastic material, and you imagine that our intravenous pressure is around 70-80 millimeters of mercury, you can easily see that with every kind of movement or even standing up, you are able to overcome this pressure. And this means that for every movement, for each kind of or all kind of movements, you are able to overcome the intravenous pressure and restore a kind of valve mechanism. You see here, even during a dorsiflexion in supine position, when you stand up or during walking, you are able to completely occlude the vein lumen, so restoring a kind of valve mechanism. And this is possible both with inelastic bandages, as we saw, but also with adjustable compression wraps, exactly the same phenomenon. And this is not possible with elastic material, because elastic material, the pressure exerted by elastic material is far too low compared to intravenous pressure to exert any hemodynamic effect. In fact, when compare elastic and inelastic material, we see that inelastic material is significantly more effective in improving the impaired venous hemodynamics by reducing ambulatory venous hypertension, and this can be achieved by reducing and abolishing venous reflux, increasing venous pumping function. And so, what kind of material will we use? Mild pressure exerted by elastic stocking, or strong pressure and exerted by inelastic bandages or adjustable compression wraps? This depends on the clinical scenario, reflecting an underlying hemodynamic impairment. When we need an hemodynamic effect, like for instance in venous leg ulcer and lymphedema treatment stage, we will need a strong pressure exerted by inelastic bandages or adjustable compression wraps. But when a hemodynamic effect is not necessary, like in case of healed ulcers or lymphedema maintenance phase, in this case a mild pressure by elastic stocking or elastic bandages will be enough. And if we go to this nice slide summarizing all the main indication for compression, you will see that from C0S to C5, we have only indication for elastic stocking. So we could consider C0S to C5 kind of elastic stocking kingdoms, while for other indications, like for instance ulcers or deep vein thrombosis or lymphedema, acute stage, we will use, the better indication will be for inelastic compression. So if we want to summarize this indication, we could say that bandages or adjustable compression wraps are indicated in the therapy phase, so to say, so in reflecting a clinical stage in venous ulcer, post-procedures, acute superficial vein thrombosis or deep vein thrombosis, and lymphedema initial phase, while stocking or adjustable compression wraps with low stretch will be used in the maintenance phase, so again, CC 0S to C5, thromboprophylaxis, post-thrombotic syndrome, post-procedure, lymphedema long-term. There are some critical points within elastic bandages: pressure loss over time and education that is extremely necessary. Pressure loss over time. We know that with inelastic bandages, we have a significant pressure loss. Even if after a few hours the pressure decreases dramatically, but this is not a big problem from a functional point of view, because we saw that even after 7 weeks, despite of 7 days, despite of a significant pressure loss, the decrease in effectiveness regarding ejection fraction for inelastic bandages is decreased, but not so much. And the effectiveness is still in the normal range. While for elastic stocking, you never have, neither after preclusion, neither after some days, an effectiveness concerning hemodynamic effect. The real critical point with elastic bandages is education, because as you can see from this slide, study of Christine Protz in Germany, they were able to show that only a minority of expert personnel is able to exert the proper pressure with a certain kind of inelastic bandages. The great majority, more than 90% of expert personnel, applied a pressure very low, about in the same range as elastic stocking, while a very few expert personnel applied a so strong pressure that is completely useless and on the other hand potentially harmful for the skin. So we need material, and we need to be educated to this material. And with elastic stockings, we need to know that they have mild or moderate, they can exert mild or moderate pressure with low stiffness, so they will be hemodynamically ineffective or poorly effective. Pressure will be maintained over time, and expert personnel to be applied is not required. Inelastic compression bandages exert a strong pressure with high stiffness. They are hemodynamically effective. The pressure, unfortunately, falls down over time, and expert personnel, this is crucial, is necessary to be applied. With adjustable compression wraps, we have kind of mixture of this effect, because adjustable compression wraps are able to exert a strong pressure with high stiffness. They are hemodynamically effective. The pressure is maintained over time thanks to patient readjustment. Expert personnel, so is not necessary to apply this kind of compression pressure. Common mistakes to avoid in compression pressure: inadequate compression pressure, usually too low when a strong pressure is necessary, sometimes uselessly too strong when a strong pressure is not required. Another common mistake, wrong indication, for instance, elastic stocking in ulcer treatment and elastic material in mixed or arterial ulcers. Technical mistakes, for instance, strangulation, not starting with the base of the toe, so forefoot edema, or not arriving below the knee, so allowing slippage of the compression pressure, of the compression device. Conclusion: materials and their physical and hemodynamic characteristics must be well known when applied compression pressure. Elastic and inelastic material have different physical and hemodynamic properties and different clinical effectiveness. Inelastic bandages require proper education to be correctly applied. Elastic stocking and adjustable compression wraps are easy to use and may allow self-management, but while elastic stocking are ineffective from an hemodynamic point of view, adjustable compression wraps are hemodynamically effective and can potentially replace inelastic bandages. Thank you very much for your attention.